Endometriosis. What every woman needs to know. The endometrium is the inner lining of the uterus or womb that thickens, bleeds, and sheds every month during your period. Endometriosis is a condition in which tissue similar to the lining of the uterus grows outside of the uterus. Often these lesions or growth can be found in the ovaries, fallopian tubes, uterus, bowels, and bladder. The cause of endometriosis is currently unknown, but it is estimated that it affects more than 11% of American women between the ages of 15 and 44. Although it typically affects women from ages 20 to 30, it can affect any female that menstruates. You may be at a higher risk of developing endometriosis if your period started before the age of 11, you have a mother, sister, or daughter with endometriosis, you experience heavy menstrual cycles that last more than 7 days, or you have short monthly cycles. The most common symptom of endometriosis is pain, and this can vary from having severe menstrual cramps that may get worse over time, chronic pelvic pain, pain during or after intercourse, pain with bowel movements or urination during periods. Current evidence suggests that the pain may be related to endometriosis growths that swell and bleed the same way the endometrium does every month during your period. The tissue grows and bleeds, but it cannot exit the body, thus causing pain. Other symptoms associated with this condition may include spotting or bleeding between periods, heavy periods, and fatigue. To begin the diagnosing process, the doctor must have a complete medical history, as well as perform a physical exam and pelvic exam. The only definitive way to confirm a diagnosis is through a laparoscopy. During this procedure, the doctor makes a small incision in the abdomen and inserts an instrument with a light called a laparoscope. This is done to look at the reproductive organs and other surfaces to see if there is any evidence of endometriosis. The doctor can make a diagnosis based on what is seen inside the abdomen, or in some cases, a small tissue sample may be obtained to study under a microscope and then confirm the diagnosis. Currently, there is no cure for endometriosis. However, there are different methods to treat the symptoms. One option is pain medications. This may be prescribed and used for symptoms that are mild. Your doctor may suggest non-steroidal anti-inflammatory drugs or NSAIDs, such as ibuprofen, also known as Advil or Motrin. Or for severe pain, the doctor may prescribe opioids. Another option is hormone treatments. Because hormones cause the lesion to go through a cycle similar to the menstrual cycle, the use of hormones can be effective in treating symptoms by suppressing the growth. This can be obtained through the use of birth control. Extended or continuous cycle may be prescribed. It should be noted that through this method of administration, you may experience few periods per year or no periods at all. Another option is gonadotropin-releasing hormone agonists. This medication stops the body from making hormones responsible for ovulation, the menstrual cycle, and the growth of endometriosis. It should be noted that this can cause temporary menopause, so you may experience side effects such as hot flashes, mood changes, trouble with sleep, vaginal dryness, and joint and muscle stiffness. But not to worry, when this medication is stopped, the body comes out of the menopausal state and menstruation begins, but endometriosis symptoms return. If the other options are not providing relief and your symptoms are very severe, you may want to speak with your doctor about surgical treatments. To remove the endometriosis, the surgeon may perform an excision of lesions, or use cautery to destroy the lesions with heat, and if damage is severe enough, a hysterectomy, a removal of the uterus, may be performed. It should be noted that pain may return within a few years after surgery. As a patient, please remember to follow your doctor's orders, take your medication as directed, and report any unwanted side effects.